Good evening, everybody. Welcome back to Bread and Butter Primary Care. I'm Dr. Stokes, and today's video is about type 2 diabetes, medication management beyond metformin. So these are non-insulin treatment, so we're not talking about insulin yet. We have a video where we talked about metformin, so this video is particularly for what to do after metformin. What are the options? How do you know, out of the multitude of medications that exist, what to do next to treat people who have type 2 diabetes? Now, before we start this video, I do want to say that it is not intended to be a comprehensive video. That's one of the things that I found a little bit difficult about some of the medical information videos that I can find on YouTube and on the internet, is they tend to be comprehensive, which in some ways is good because it gives you all the information. In other ways, you have a 45-minute video to listen to in order to hear what they're going to have to say. And so this is not intended to cover all medications in all situations. This is, as the title of the channel, Bread and Butter Primary Care. So these are the medications that you use over and over and over again in primary care, and kind of the order that you go in as far as adding these medications. There is a lot that changes in the treatment of type 2 diabetes, which medications come first and last. There's a lot of comorbidities that matter with the different medications, and so we're going to talk briefly about those. Just to give you a sense, if you're in your preceptorships, if you're doing an endocrine rotation, whatever the case may be, and you want a better sense of what to do. One of the things that I found in practicing medicine is that you start early on in your career, or as a medical student or a PA student or whatever the case may be, you start with just kind of a memorized way of treating things, and then as you progress, you start to learn more and more about why you do things, and then you start to customize things so that every type 2 diabetic patient is a little bit different. When you're first starting out, it sometimes feels like you're treating every single patient exactly the same because you have your little system and it works, and so you do it, and that's okay. You'll gain experience, you'll get more comfortable with these medicines, and what once seemed like just a huge list of impossible medicines to remember will be very simple after you have a lot of experience doing these things. And so again, bread and butter primary care, kind of what I tend to do when I'm treating someone for type 2 diabetes, just to give you an idea of how to get started, knowing that you're going to increase your knowledge, you're going to increase what you do as you progress in your practice and in your career. All right? So you've got a patient, they've come in, you did some screening labs, they had a high A1C, you instituted lifestyle changes, you gave that a chance, they came back, their A1C was a bit higher, you started metformin, they're taking 1,000 milligrams twice a day, they're back for their 3-month follow-up, you do that A1C, and it's still high. So you've got an A1C of 8, and they're on metformin twice a day, they're trying to do the lifestyle stuff, so now what? To start out, I want you to remember 3 classes of medications. Now each class has several individuals in it, but the classes is the more important thing to know. If you go into your preceptor after seeing a patient and you say, hey, I want to start a GLP-1 inhibitor, or I think we should start a DPP-4 inhibitor, or I'm sorry, GLP-1 agonist, or a DPP-4 inhibitor, or an SGLT2 medication, that's going to be great. If you don't know the exact individual drug name, that's okay. That's going to come. So 3 classes. That's it. We've already got metformin. 3 classes. DPP-4 inhibitors, GLP-1 agonists, and SGLT2s. Okay, so those are the 3 classes: DPP-4, GLP-1, SGLT2. And we're going to talk about each one. Now, you might notice that I did not mention sulfonylureas. These are very common medications. They're very old medications. They are at the very bottom of pretty much every algorithm you'll see for the treatment of type 2 diabetes. But they are used frequently because they are so affordable and they're so well known. And so I'm going to do a separate video on sulfonylureas and how they work and what to do. And so I wanted to mention that I'm not talking about those, even though you will see those used early on in someone with type 2 diabetes. So these three classes. So DPP4 inhibitors and GLP-1 agonists, those first two are related. They actually work in the same pathway but in a different way. So DPP4 inhibitors are oral medications. Those are pills that people take. These are pills such as, they're the gliptins. Okay, so sitagliptin, allogliptin, things with a gliptin end. Some of the brand names of these medications would be Januvia, Nesina, Onglyza, Tradjenta. So these medicines inhibit DPP4. DPP4 degrades GLP-1. I know there's a lot of letters here, but what you want to remember is GLP-1 is a protein that helps keep sugars down. Okay, obviously there's more details in it than that, but just remember that. The GLP-1 protein helps control high blood sugars. There's two ways to increase GLP-1, which would help control blood sugars. You can stop its breakdown, or you can just give it straight to the patient. And those are those two classes of medications. DPP4 inhibitors inhibit the enzyme that breaks down GLP-1. So if you give someone a DPP4 inhibitor, those are the gliptins, you're going to break down that enzyme, and so the GLP-1 is going to, the amount that's available is going to increase because you're not breaking it down as much. So the nice thing about the DPP4 inhibitors is they're very easy to take. They're usually just one pill once a day. And people tend to prefer pills over injections. So you've got them on metformin, you're looking for that second medicine. DPP4 inhibitors are a great medicine to do for your second thing. They increase GLP-1 by slowing the breakdown. So the second class is GLP-1 agonists. So instead of stopping the breakdown of GLP-1, why not just give the patient more GLP-1? Well, you can. Those are those medications. So these medications are the glutides. So the medication that ends in that glutide, liraglutide, and the others. The brand name for these medications are things like Byetta, Bidurion, Victoza, Trulicity, and there's some others as well. These are injectable medications. So they come in pens that you can just kind of put in the abdomen or on the leg and inject the medication. They are excellent, excellent medications. I'm going to do separate videos on each one to talk more in detail, but like I said, the DPP4 inhibitors slow down their breakdown, and so GLP-1 goes up. You can just inject GLP-1 directly. Some of these injections are once a week, and then they work all week, so you don't have to take a pill every day. So they're an excellent option for the control of diabetes after metformin. So you've got metformin going, it's not working, start a DPP4 inhibitor. That would be fine. If you'd rather do a GLP-1 injection, that would be fine as well. The third class are the SGLT2s. The SGLT2s are the medications that trick the kidneys into allowing sugar to pass. Okay, so a normal kidney will not allow sugar out unless it's extremely high. So it is programmed, the kidney is programmed to keep the sugar in the blood and not let it get out in the urine. You can do that. You can change that with the SGLT2 medications. They alter the function of the kidney, so it's just like, you know what, go ahead and let the sugar out. So people on those medications will have a very sugary urine, so that lowers the sugar. It causes some diuresis or increase in urination, so it can also lower blood pressure. There's a lot of new studies that have been showing that these medications can actually help reduce blood pressure and heart disease. So they're very good medications for people who have those complications. So that's it. I mean, I know that's brief. Like I said, there's going to be videos about each medication, but if they're on metformin and you want to know what should I do next, think of three options. A DPP4 inhibitor, one pill once a day, that'll increase GLP-1 by stopping the enzyme. Just inject GLP-1, Byetta, Victoza, Trulicity, or use an SGLT2, make them pee out urine. So those are kind of the first three things to think about after metformin. Of course, also the lifestyle changes. Like I said, stay tuned for more information about each one of those medicines, when to use them, when not to, when to kind of pick one over the other, but in general, that's some good information.